السلام عليكم ورحمة الله وبركاته. License exam for Laboratory Technologist. First question. A healthy person with a blood glucose 80 mg 4.4 millimole would have simultaneously determined cerebrospinal fluid glucose value of A 25 mg, B 50 mg, C 100 mg, D 150 mg. So we know that إنه CSF glucose is about 60% of serum glucose. This means we'll multiply 80 by 60%, which is approximately 48 milligram deciliter. So the correct answer will be B. Second question. The preparation of a patient for a standard glucose tolerance test should include a high carbohydrate diet for 3 days, a low carbohydrate diet for 3 days, or fasting for 48 hours prior to testing, or bed rest for 3 days. For glucose tolerance test, the patient should have a high carbohydrate diet for 3 days. So A is a correct answer. Third question. Cerebrospinal fluid for glucose assay should be refrigerated, analyzed immediately, heated to 56 degrees centigrade, or stored at room temperature after centrifugation. For glucose determination in cerebrospinal fluid, it should be analyzed immediately. So the correct answer is B. Fourth question. Syphilis is caused by the following organism: Mycoplasma, Treponema pallidum, ولا Neisseria species. Syphilis is caused by Treponema pallidum. So the correct answer is B. Screening test for syphilis is RBR or VDRL, TBHA or coagulase test. The screening test for syphilis is RBR or VDRL. The following question. Confirmatory test for syphilis is RBR, VDRL, TBHA or coagulase test. The confirmatory test for syphilis is TBHA. Next question. Lipoproteins are separated using ultracentrifugation based on density, volume, charges. Lipoproteins are separated using the ultracentrifugation based on density. So the correct answer is density. Next question. In semen analysis, which is an abnormal value? Volume 1.5 to 6.7 milli, liquefaction time 40 minutes, motility 50% rapid progressive, pH 7.5. The abnormal here for the semen analysis is liquefaction time 40 minutes. Next question. Bacteria grow only in the presence of oxygen, called obligate aerobes, anaerobic, facultative. The correct answer is obligate aerobes. Next question. Define piglocytosis. Presence of different RBCs shape, ولا change in volume, or change in number. Piglocytosis means presence of different shapes of RBCs. So correct answer is A. Question number 11. Shift to left expression is given to monocyte, lymphocyte, or neutrophils. Shift to left expression is given to neutrophils. So correct answer is D. C. Next question. Long-term glucose monitoring test is GGT, GLT, hemoglobin A1C. The correct answer is C. Hemoglobin is AC. Hemoglobin A1C is used to monitoring glucose for the last 3 months. Cabot ring rarely seen in white blood cells, platelets, or RBCs. Cabot ring rarely seen in RBCs. Question number 14. Cabot ring presence indicate infection, megaloblastic anemia, or high MCHC. Cabot ring presence indicates megaloblastic anemia. Question number 15. Hemophilia A patient have deficiency in which factor? Factor 8, factor 3, or factor 4? Hemophilia A patient have deficiency in factor 8. What is the cause of hemolytic anemia? Decreased production of RBCs, increased destruction of RBCs, low iron level. The cause of hemolytic anemia is increased destruction of RBCs. So correct answer is B. Question number 17. Blood film from iron deficiency patient shows microcytic hypochromic, ولا thrombocytopenia, ولا macrocytosis. The correct answer is microcytic hypochromic cells. Question number 18. Define leukopenia. It is low platelets, high white blood cells, low white blood cells. Leukopenia is low white blood cells. Question number 19. Mean equal 20.5 is D. The standard deviation equal 2.3. Calculate the coefficient variation, CV percent. CV percent equation equal the standard deviation divided by the mean and multiplied by 100. So CV percent will equal 2.3 divided by 20.5 0.5 multiplied by 100 will equal 11.2%. So the correct answer is B. Question 20. What is the CV percent? It is a test for variance, test for imposition, test for F-test. CV percent, it is a test for imposition. So the correct answer is B. False thrombocytopenia may be due to bone marrow defect, platelet clumping, or neutrophilia. The false thrombocytopenia may be due to platelets clumping. So B is correct. Question 22. What should you do in case of false thrombocytopenia? Repeat the test from the same tube. Collect second sample in editor. Collect second sample in saturated tube. The correct answer is C. You should collect second sample in saturated tube because maybe the effect of editor is the cause for thrombocytopenia. And you need later to multiply by 1.1 factor of dilution of sodium citrate. So in case the result here for platelets is 100, you should multiply by 1.1 to get the final result for the correct platelets count. Question 23. What is the mean of 1 to S rule? It is a rejection rule, warning rule, accept and continue. 1 to S rule is meaning warning rule. Question number 24. The conversion of glucose or other hexose into lactate or pyruvate is called glucogenesis, glycogenolysis, gluconeogenesis, or glycolysis. Conversion of glucose or other hexose to lactate and pyruvate called glycolysis. So D is correct. Question number 25. The glycated hemoglobin value represents the integrated value of glucose concentration during the preceding 1 to 3 weeks, 4 to 5 weeks, 6 to 8 weeks, 16 to 20 weeks. It is approximately for the last 3 months. Okay, so here the correct answer will be C. Question 26. The characteristic erythrocyte found in pernicious anemia is microcytic, spherocytic, hypochromic, ولا macrocytic. The characteristic erythrocyte found in pernicious anemia is macrocytic. Question 27. Heinz bodies are readily identified with polychrome stain, rarely found in glucose 6-phosphate dehydrogenase deficient erythrocyte, closely associated with spherocytes, denaturated hemoglobin inclusions that are readily removed by spleen. The correct answer is D. Question 28. What cell shape is most commonly associated with an increased MCHC? Teardrop cells, target cells, spherocytes, skull cells. The correct is spherocytes. Question 29. The direct antiglobulin test is often positive in congenital hemolytic spherocytosis, MARSH, hemoglobinuria, acquired hemolytic anemia, ولا thalassemia major. The correct answer is acquired hemolytic anemia. Question 30. Laboratory findings in hereditary spherocytosis don't include decreased osmotic fragility, increased autohemolysis corrected by glucose, reticulocytosis, shortened erythrocyte survival. We know that in hereditary spherocytosis the osmotic fragility will increase. So the correct answer is A. Question 31. The most appropriate screening test for detecting hemoglobin F is osmotic fragility, dicyanate solubility, Kleihauer test, or heat instability test. For detecting hemoglobin F, we are doing Kleihauer test. So C is the correct answer. Question 32. The principal confirmatory test for hereditary spherocytosis is osmotic fragility, sucrose hemolysis, heat instability, Kleihauer test. The correct answer is osmotic fragility. Question 33. The Prussian blue staining of peripheral blood identifies whole jewel bodies, siderotic granules, reticulocytes, basophilic stippling. The correct answer is B. Question 34. Which of the following is used for staining reticulocytes? The correct answer is new methylene blue. Question 35. The term shift to left refers to a microscopic adjustment in mature cell forms in the peripheral blood, a trend on Levy-Jennings chart, a calibration adjustment on the instrument. The correct answer is B. Immature cells forms in the peripheral blood. Question 36. Which of the following clean cat urine culture colony counts indicates the patient likely has a urinary tract infection? 10 to the power 1 colony forming unit per ml, 10 to the power 3, 10 to the power 5, no gross. The correct answer is C. 10 to the power 5 colony forming unit per ml. Question number 37. When processing throat swab for a group A streptococcus culture, the medium of choice is sheep blood agar, rabbit blood agar, human blood agar, horse blood agar. The correct answer is A. Sheep blood agar. Question 38. Salmonella enteritis is isolated from multiple blood culture in a patient with fever. Susceptibility results are as follows: ampicillin susceptible, cefotriaxone susceptible, ciprofloxacin susceptible, trimesoprene sulfomethazole resistant. What is the next best step? Report all the susceptibility testing result with no changes. Perform beta-lactamase test on the isolate before reporting the ampicillin as susceptible. Test the isolate against nalidixic acid, and if resistant, report the ciprofloxacin as resistant. report gentamicin since trimesupreme sulfamixazole is resistant. The correct answer is C. You will test the isolate against nalidixic acid, and if it is resistant, report ciprofloxacin as resistant. Question 39. Which of the following antimicrobials would be inappropriate to report on E. coli isolates from a wound culture? Gentamicin, ampicillin, cefazolin, nitrofurantoin. The correct answer is nitrofurantoin. Nitrofurantoin only, it should be reported in urine culture only. All isolate from urine culture. Question 40. A reliable test for distinguishing Staphylococcus aureus from other staphylococci is oxidase, coagulase, catalase, optician susceptibility. The correct answer is coagulase. Staph aureus is positive coagulase. Other are coagulase negative. Question 41. The first procedure to be followed if the blood gas instrument is out of control for all parameters. Recalibrate, then repeat the control. Repeat control on the next shift. Replace electrodes, then repeat control. Report patient result after duplicating the testing. So the correct answer is A. You need to recalibrate, then repeating the control. Next question. Refer to the following graph. A new methodology for amylase has been developed and compared with the existing method, as illustrated in the graph shown above. The new method can be considered as poor correlation with constant bias, good correlation with constant bias, poor correlation with no bias, good correlation with no bias. There is a good correlation since all the point is around the line, and there is constant bias up and down. So the correct answer is B. The precision of an instrument is validated by running the same sample multiple times, performing serial dilution, processing unknown specimen, monitoring normal and abnormal control. So the correct answer is A. It is the running of the same sample multiple times. Next question. An index of precision is statistically known as the median, mean, standard deviation, or coefficient of variation. The index of precision is called coefficient of variation. The term used to describe reproducibility is sensitivity, specificity, accuracy, precision. The correct answer is precision. The extent to which measurements agree with the true value of the quantity is known as reliability, accuracy, reproducibility, precision. The correct answer is accuracy. If the correlation coefficient R of the two variables is 0, there is complete correlation between the variables. There is an absence of correlation. As one variable increase, the other increase. As one variable decrease, the other increase. The correct answer is B. There is an absence of correlation. The good correlation should be either +1 or -1 or in between, but 0 is no correlation at all between the two variables. A technician is asked to clean out a chemical reagent storeroom and discard any reagent not used in the past 5 years. How should the technician proceed? Discard the chemicals into biohazard containers where they will later be autoclaved. Pour reagent down the drain followed by flushing of water. Consult MSDS sheet for proper disposal. Pack all chemicals for incineration. The correct answer is consult the MSDS, which is the safety data sheet, okay, for each chemicals to tell you how to dispose these chemicals. Which chemical is potentially carcinogen? Potassium chloride, formaldehyde, mercury, picric acid. The correct answer is formaldehyde. A lipemic serum is separated and frozen at -20 degrees centigrade for assay at a later date. 1 week later, prior to performing an assay for triglycerides, the specimen should be warmed to 37 and mixed thoroughly, warmed to 15 degrees and centrifuged, transferred to a glycerated test tube, discarded, and a new sample obtained. The correct answer is A. In a specimen collected for a plasma glucose analysis, sodium fluoride serve as a coenzyme of hexokinase, prevent reactivity of non-glucose reducing substance, precipitate protein, or inhibits glycolysis. Sodium fluoride is used in glucose test to inhibit glycolysis. So the correct answer is D. To get more MCQs, please subscribe and like, share, and good luck.